My pathology is pulmonary embolism. One of the first exams ordered with somebody presenting symptoms of pulmonary embolus would be a chest X-ray. So today I'm going to show you how to do a PA and lateral chest X-ray. First thing you're going to do is have your patient change into a gown and removing everything from the waist up, any jewelry, clothing, bra, anything that's going to be in the area of the chest. And then you're going to get two patient identifiers. So you could do name, birthday, check the wristband, and then I'm going to have my patient here, Nicole, come stand and put her chest up against the board, up nice and close to where you're actually touching it. If the hair was thick enough, we would probably pin it up so that way it wouldn't show up in the image. They're going to put the the back of their hands on the back of their hips, like this, and you're going to let the shoulders roll forward to get the scapula out of the way of the lung field. And then you're going to feel for the inferior angle of the scapula, which is about T7 for your centering. So you're going to feel right here. Which is about where we're centered at. I have my tube at 72 inches and it's in transverse detent. And then I also am using a 14 by 17 cassette crosswise. And I've lined up my tube to my cassette. Let your shoulders roll forward. And you just want to make sure that you have enough light above the shoulders in order to get all the lungs on there. You're going to mark it with the left marker over here, and you want to make sure it's still in your light, but not going to be in the anatomy of the apices of the lungs. You're also going to shield your patient and have a shield wrapped around her waist. Ideally, you would like a wraparound shield to protect the reproductive organs from the backscatter, but we'll just use this one right now. And this breathing instructions for this are double inspiration. So you take a deep breath in, blow it out, another deep breath in, and you're going to hold it and then expose. I'm also going to measure for my exposure factors. It looks like she's at 22. So I would set my board and then take my exposure. For the second projection, we're going to do a lateral chest X-ray. So I have my patient here on her left side up against the board. We have her shield. We turn the shield so it's facing the tube to protect her reproductive organs. Again, a wraparound shield would be ideal. We're going to make sure her feet are shoulder width apart so she's stable and balanced. We have her shoulders as close as we can to the board. I changed my cassette. I now have the 14 by 17 cassette lengthwise, and I changed my collimation on my tube as well. We're still at 72-inch SID. We're going to have her arms all the way up to make sure that they're out of the way, touching the elbows. And then we're going to make sure her hips aren't rotated. So make sure those are straight. We're going to check for rotation with the scapula. They should be superimposed. So I'm just going to put my hand on both of them and feel for them to make sure that we'll have a perpendicular line from the image receptor. That's right. And we're still centering at T7, or the inferior angle of the scapula. And we also want it to go through the mid-coronal plane. Right there. We're also going to put a left marker on here. We're going to make sure it's still in the light, but not in any anatomy. Just kind of check for light. For smaller patients, we could also collimate in more from the 14 by 17. Just make sure we're not cutting off any anatomy and the angles of the lungs. And for this one, the breathing instructions are double inspiration, so a deep breath in, blow it out, another deep breath in, and hold it, and then we would expose. I also need to measure for my exposure factors. You go through where the beam would go, or measure through where the beam would go, which is 30. And that is everything for the lateral chest X-ray.